Forward for the full schedule.
Take Charge Parenting with the Kids Doctor is brought to you by Children's Health.
February is Heart Month, and Children's Health is on a mission to help parents keep their children heart healthy at home, at school, and on the athletic field. Dr. Sue Hubbard is an award-winning pediatrician and medical editor of KidsDR.com, and Dr. Colin Kane is a cardiologist with Children's Health. We say welcome to both of you.
Good morning.
Good to see you. So I think, Dr. Sue, when we hear the words heart disease, we immediately think of an adult, maybe even an older adult, and don't think it could be associated with kids, but it can. So what are the signs and symptoms we should be looking for?
So you can be born with heart disease, which is congenital heart disease, but you can have acquired heart disease or something that doesn't show up till you're older, and you should be looking then for things like chest pain with exertion. That's really important. Or fainting with exercise. Or you might go to your pediatrician, they notice a new murmur, or sometimes kids complain of a irregular heartbeat, and it kind of seems to happen more than one time. Those are things that you should be paying attention to.
So if parents think their kids may be exhibiting some signs of a heart issue, what steps should we be taking right now?
First one is call your pediatrician.
Okay.
I would start with your pediatrician and let them help evaluate your child. And that's why we have Dr. Kane.
Yes. Speaking of Dr. Kane, my next question is for you. Are there any preventative measures that parents can be doing now to, take those steps to ensure that their kids are heart healthy?
Sure. When parents ask me that question, I usually suggest that they start instilling heart-healthy habits right now with young kids. Make sure they see plenty of exercise, make sure that they're eating a healthy diet, and the parents should be showing behavior that their children will then want to emulate when they're older to lead to a healthy heart.
A lot of our viewers have probably seen this video. I don't know about the two of you, but just a few months ago in Georgia, a high school volleyball player suffered a cardiac incident on the court. You can see it right here. It's hard to watch. She is okay. But the video, nonetheless, is very hard to look at. So how can a family evaluate their child's heart risk before they step on to the court or the field?
Sure. I think that every young athlete should be evaluated before their sports season. And I think that the best place for that evaluation to start is with the primary care doctor, either with someone like Dr. Sue or one of the pediatricians with the Children's Health Pediatric Group. The pediatricians and the primary care doctors know the proper questions to ask and the physical exam to do that may show signs of a heart problem.
What would you say are some of the most common conditions Children's Health Heart Center treats?
So there's a wide range of heart conditions that we may evaluate for. In the outpatient area, we see lots of kids that are sent by a pediatrician for concerns such as complaints of chest pain or palpitations, as Dr. Sue mentioned, or maybe a murmur. And then, in the hospital, a significant part of our patient volume is congenital heart disease. So, as Dr. Sue said, heart problems that the child was born with.
We all hear about rankings, but to really break it down, Dr. Sue, Children's Health has actually been recognized for outstanding care for young cardiac patients, receiving a 3-star rating from the Society of Thoracic Surgeons. So how important is it to have a rating like that?
I think what
does it mean?
Well, number one, I think we're so fortunate to have such excellent facilities here in North Texas and to have cardiologists, pediatric cardiologists, and pediatric thoracic surgeons. Dr. Kane, explain the 3-star.
Yeah, so this is something that we're very proud of at the Heart Center with Children's Health. The 3-star rating, 3 stars is the highest level of rating that the STS gave to hospitals that do congenital heart surgery.
Wow.
It means that our outcomes were significantly better than the national average. And there were only 6 of these programs in the country, and we are the only one in Texas to receive the 3-star rating.
It's important to remember because don't we all want the best care for our kids? Thank you, doctors.
It's scary when you hear heart.
It really is, yeah, and when we see video like that.
Yeah, but we've got good doctors to do the treatment.
Absolutely. Good to see you, and you can find out so much more about the best ways to stay heart healthy all year long online at childrens.com/heart. You can also follow Children's Health and the Kids Doctor on Twitter and Facebook.